Welcome back, everybody. January is Cervical Health Awareness Month. And joining us now to talk a little bit about cervical cancer and how it can be prevented is Dr. Helen Gray with St. Mary's. Dr. Helen, thanks so much for being with us.
Thanks for having me.
All right, let's talk a little bit about cervical cancer and how you can get it.
So cervical cancer, basically, it's where the cervical cells are growing out of control. Typically, we get it from the HPV virus, which is human papillomavirus, and that's transmitted usually only through sexual contact with someone who's been infected with that.
Is that the only way, though, to get it is through HPV?
That's the most common way and most known way, yes.
All right, so let's talk about who's at the greatest risk of developing cervical cancer.
So obviously, like we said before, usually you would have to contract HPV. Typically that is contracted and it goes away. We resolve it just like a cold virus, we would do that. But females who have prolonged infection with the HPV virus, females who have been on birth control for longer than 5 years can be more at risk. Females who smoke, have HIV, other autoimmune deficiencies, those females are at greater risk.
So obviously the big question then is, can it be prevented? And if so, how? What's the best way to prevent cervical cancer?
So, as far as prevention, it would be going to get your routine screening test, and that's your Pap exam, where we're testing those cervical cells for any changes, and then if need be for that HPV virus.
So we had a report out today in regards to when should people be having their annual Pap tests? Every 3 years? Is it 1 year? Talk to us a little bit about this newest information out, and is that going to change your guidelines?
Right. So it's still controversial. Every time new guidelines come out, it becomes controversial. There's many different sources. There's the United States, Preventative Task Force. There's the American Cancer Society. Current guidelines right now say that we don't actually start screening until the age of 21, regardless of sexual activity at this point. And then current guidelines will say every 3 years until you reach a certain age group, and then possibly every 3 to 5, depending on if you're testing for the HPV. Within our community, within various physicians, you will still find physicians that still screen every year because those guidelines are just that, they're guidelines, and every single patient's story and patient's symptoms are going to be very different. And then the reality is there's no screening test that's perfect. So whether we test every year or we test every 3 years, there's still going to be some cervical cancers that we don't catch.
I guess the key is just get tested. That's the main point. All right, Dr. Helen Gray, thank you so much for being with us. A lot of great information. We appreciate it. And now we go over to meteorologist Tim Studebaker with a quick look at our forecast. Hi, Tim.
Good morning, Melissa. We have a big ridge off the west coast. It's been with us for a little while. It's going to be with us for the foreseeable future. We'll talk about what that means for our weather coming up after the break.